Thank you for joining us today for our training on the use of the NHSN point of care test reporting tool for COVID-19. We hope that the training will answer many of the questions that you have and optimize your use of the tool. My name is Kathy Allen Bridson, and I'm a nurse consultant with the CDC's Division of Healthcare Quality Promotion. Today, we will cover some background information related to the statutory requirements for reporting the results of point of care, or POC, test results for COVID-19, and how NHSN plays a role in that reporting, go over data entry, talk briefly about the analytics currently available for POC test result data in NHSN. We'll also review some frequently asked questions that we have received and identify resources for questions about the NHSN POC test reporting tool system, which I'll just simply refer to as the POC tool from here on out. Finally, I'll provide a live demonstration of data entry in a fictional long-term care facility. Please send any questions you have following this training to the NHSN at cdc.gov with POC test training video in the subject line. This schematic portrays the various elements of the long-term care facility COVID-19 module. The surveillance reporting pathways provide information on disease impacts on residents and staff, as well as the medical equipment and supplies needed to care for ill residents and prevent the introduction or spread of the disease within the facility. NHSN also has a surveillance tool for collecting COVID-19 vaccinations within long-term care facilities. We will not be discussing either of these reporting means today. Instead, we will be reviewing the POC tool, which is another method LTCFs can use to characterize the burden of COVID-19 within their facility for public health authorities. Please note, NHSN users sometimes confuse the surveillance reporting pathways, which include the resident impact and facility capacity pathway for the protocol for the POC tool. They are two different means of reporting to NHSN. While the resident impact and facility capacity pathway does collect data about numbers of tests performed and numbers of COVID-19 positive residents and staff, these are only total numbers or summary data, as it's sometimes called. Personally identifiable data, such as the person's name and contact information, are not collected. Instead, that line level data, as it's called, is collected via the POC tool and can be used for contact tracing and other uses. If your state health department calls you and says they haven't received your POC data and you believe you've entered it into NHSN, make sure that you're not confusing the two reporting means. The easiest way access the NHSN long-term care COVID-19 resources is via the NHSN website at the URL in the upper right-hand corner of the slide. Once there, click on the green LTCF COVID-19 module box near the top. That will take you to a page dedicated to the long-term care facility COVID-19 module, and listed under FAQs, a bit down on the right-hand side of the page, you will find a frequently asked questions document with a wealth of information. This document was updated very recently with information about system enhancements. On this page, under training, slides for today's presentation may be found. In a few weeks, you will find a recording of this presentation once closed captioning has been applied. A data collection form and table of instructions, which lists the data elements collected through the process of reporting the information, and which also provide information about each of the data fields and how to complete them correctly, is also available. Those are also continuously updated with guidance about the data that is collected. Both the FAQ and the TOIs should be your first stop when looking for answers to questions that you might have. Before we go further, let's define what is meant by the term point of care testing. The College of American Pathologists, or CAP, defines POCT as testing that is performed near or at the site of a patient with the result leading to a possible change in the care of the patient. POCT is usually performed by non-laboratory trained individuals such as nurses, physicians, nursing assistants, and anesthesia assistants, among others. The primary advantage to POCT is the faster turnaround time for results. An additional advantage is that these tests often require less sample volume than tests performed in the laboratory. Point of care testing is also defined as tests designed to be used at or near the site where the patient is located, that do not require permanent dedicated space, and that are performed outside the physical facilities of clinical laboratories. Examples include kits and instruments that are hand carried or otherwise transported to the vicinity of the patient for immediate testing at that site. For instance, capillary blood glucose, or analytic instruments that are temporarily brought to a patient care location. For example, the operating room or an intensive care unit. POCT does not include limited service satellite laboratories with fixed dedicated testing space. Let's talk a little bit about the impetus and the process for NHSN's POC tool. The U.S. Coronavirus Aid, Relief, and Economic Security Act, better known as the CARES Act, has many portions, one of which requires the reporting of the results of every test performed to detect or diagnose a possible case of COVID-19 to the Secretary of the Department of Health and Human Services within 24 hours of results. Facilities that are performing point of care testing are included in these requirements. The Act recognizes that it is imperative for states and local health departments to receive the data so that the data can be acted upon, and it offers several ways in which that reporting can be accomplished. As I just mentioned, there are a number, actually 4 acceptable ways for the POC test data to be reported by CMS certified nursing homes. You may see all of them at the link provided in this slide. Facilities can, 1, report data directly to their state or local public health department, which will in turn report to the CDC. 2, they can also submit their data via a centralized platform, such as one provided by the Association of Public Health Laboratories, which will in turn route the data to the state health department and the CDC. 3, they may submit through a state or regional health information exchange to the state or local health department and to the CDC. Or 4th, as is provided in this slide, they may report via the NHSN, which is the Center for Medicare and Medicaid Services and CDC's preferred method. From the NHSN, data will be routed to the state health department and to CDC programs and the Department of Health and Human Services. So if there are so many possible ways for facilities to transmit their POC test data, why was it important to create a method by which it could flow through CDC to other data users? Many is always not better. Many is not always better. Creating an NHSN tool for this purpose offers an opportunity to avoid a patchwork of different jurisdictional reporting systems by state health departments. It can share the data with HHS and CMS, as well as state and local health departments. And the NHSN is already used by nearly all 15,000 nursing homes for other COVID-19 reporting. It's very important that nursing homes do not make changes to their reporting methods without first checking with their state and local health departments. This will ensure that the data continues to reach those who need it and prevent unnecessary problems. This is a schematic of the data flow from the long-term care facility. Starting on the left-hand side, you'll notice that individual nursing homes will enter their POC test data into the NHSN system. From there, the data is accepted by NHSN, which ingests the data and generates an HL7 message, which is a standardized format of the message, and sends it every 15 minutes to the Association for Public Health Laboratories, or APHL's Informatics Messaging Services platform, or AIMS platform. The files are routed based on the state where the nursing home is located. Or in the case where an individual works in a state different from where they reside, to that state. That takes place every 2 hours. State health departments then submit the laboratory data to the CDC. And from the CDC, the data is communicated to the US Department of Health and Human Services in a de-identified manner. To date, more than 22 million test results have been reported to NHSN from over 7,500 nursing homes. Let's first talk about manual data entry. The POC tool was built to reduce the burden of reporting the data as much as possible. What do I mean by this? Well, all of the data entry is accessed by a single page, and the data elements that are required are limited to those that are required by the CARES Act or needed by state and local health departments. We also have pre-populated the county lists for each of the states, and the options for the test ordered, specimen source, and test result fields are specific for the test device used. So you don't have to sort through a lot of options that are not pertinent to the device that your facility is using. Additionally, once you enter an individual and their test results and save that data, the demographics related to that individual are saved in the system and will auto-populate when you enter that patient ID again. Editing is allowed if something has changed, but this auto-populate feature can be extremely time-saving. For facility residents, the facility address is defaulted and auto-populated. Likewise, the system has been designed to allow a facility to identify defaults for the type of device or devices which are used most often, so that a long list of devices that it does not have to be contended with. Likewise, physician information can be entered once and defaulted subsequently. The system will also default when possible to the test ordered for a specific device, as well as assigning a specimen number, since the laboratory will not be assigning an accession number. The specimen number can be edited if the facility has a system for assigning numbers, but it must be unique to that specimen. Finally, the data fields for whether the tested individual was symptomatic or pregnant automatically default to no, but can be changed to yes. So how do you go about entering data? We will go through this in a live demonstration shortly, but I wanted to include screenshots in case you wanted to go back and reference them without watching the video. You will access the POC test result reporting tool in much the same way you do to report your COVID-19 data. From the left blue navigation bar, choose COVID-19, and from the drop-down, this time you'll choose the POC test result reporting. You'll notice, as always in NHSN, the required fields are noted with a red asterisk. If the person is a resident, choose resident from the drop-down options of type of individual tested. Again, remember, if you've not been granted rights to staff data, resident is the only option you will see. Record the resident ID, which should be a number which will remain constant, for instance, should the patient leave the facility and return in the future. The top portion of the screen is demographic information for the tested individual, and the bottom portion is for test results. This shows the demographics section for a staff person or facility volunteer or contractor. You'll notice that it's longer than that for the resident. And this is because the system, as I mentioned, will automatically default the facility address and phone number for residents. This is information that has to be entered for staff, volunteers, or contractors, since they obviously don't live at the facility. There'll be a similar screen for test results performed at the facility for the third type of individuals that can be tested, that is for visitors. Without accurate CLIA numbers, and CLIA stands for Clinical Laboratory Improvement Amendments, the records can't be sent to AIMS, and ultimately neither the state nor CDC or DHHS will receive POC data. Note that an accurate CLIA number is 10 characters long, with all the characters being numbers except for the third character, which is the letter D, as in dog. It is not the facility's CMS certification number or CCN. An individual who has administrative rights within NHSN for long-term care component will need to identify the CLIA number following the instructions provided by hovering over the CLIA identification box shown here. This screen is where you will enter all the test result data. And we'll go over this in detail during the demonstration. Here's where you will add the physician information, including at least the first and last name and zip code. This will only have to be added once for each physician and then saved. You'll choose the specific device type that was used to perform the test from this screen. And during the demonstration, I'll show you how to set up a default device type or types to avoid having to search through the list each time. So a question we get sometimes is, what happens if the device that my facility is using is not listed in the application? This should be an extremely rare circumstance, as NHSN is constantly updating the list of devices. However, should it occur, check with your state health department about an alternative method to report those results until the device is added in NHSN. You can also send NHSN an email to notify us about the device. So now let's talk about the comma separated value upload options in the NHSN POC tool. POC tool has the capability to accept comma-separated value files, including the following types of data. A file which includes test results and all accompanying demographic data, or files which include only demographic data but not test results. This option has limited application, but can be useful if you're going to be moving to reporting data to NHSN and have the information in an exportable electronic format, but you will be entering the test result data manually. We'll look at this in the demonstration. There are two sources of guidance for uploading test results data by CSV. One is step-by-step instructions via the frequently asked questions document that is available on our long-term care COVID-19 page. The other is a training video specifically about this topic, also on the same page. The FAQ document also provides step-by-step instructions for uploading demographic data only. Now we'll look at the analytics options available in the POC tool. There are three current options for line lists in the NHSN POC tool. One for resident testing, one for staff and volunteer contractor testing, and one for visitor testing. Each has the option to run in the default format or can be modified with additional available data variables, sorted, or filtered in various ways. NHSN is interested to hear about additional analysis options which facilities or groups would find useful. So please send any suggestions to nhsn@cdc.gov. Always remember to generate data sets before running analysis to ensure that all entered data is included. We'll look a little bit more in detail at analysis options again during the demonstration. Generating data sets will overwrite the previous generation, previous data sets. And so the system will confirm that you want to do this, as you'll see here in this message. And this is a fictional example of a staff line listing of testing. And this is the default line list that is available without any modification, showing the variables that come with that default: facility org ID, staff ID, specimen ID, physician's name, POC device, test ordered, performed, specimen type, test result, result date, and whether or not the person was symptomatic. This is what you would get if you simply chose the line list for staff and selected run. It would include all staff results ever entered into the system and it appears that it's sorted by the first numeral of the staff ID number. So you can see all the ones and then all of the twos and threes. Maybe not the most useful way. So we will look at how we might be able to change that for more useful, in a more useful way. Next, we'll talk a little bit about some frequently asked questions that we received. And here in the upper right-hand corner is a screenshot of the FAQ document for the POC tool. And as you can see, the table of contents is set up to have with links so that you can jump to the section that has the information for which you are interested. One of the most frequently asked questions that we get is, why am I not seeing the option to report the point of care test results for staff? When I log on, all I get in the drop-down box is that for residents. And the reason for this is that we recognize that some of the information that is reported is sensitive in nature, whether or not the individual is pregnant, actually whether or not the person is actually positive for testing in and of itself can be sensitive. And so whether a facility administrator wants an individual to be able to know that about one of their peers is something that we feel the facility administrator needs to identify themselves. And for that reason, NHSN does not grant those rights by default. And instead, the NHSN facility administrator will have to grant those rights to NHSN users. So there is a way in the system for anyone with FAQ administrator rights to do that. And we're going to look at how that can be done. If that person goes to the users option on the left navigation bar and chooses find, they will get a list of all users within their facility. Alternatively, they can type in a name, first name or last name, and they will be returned a list of individuals that have that name. In this case, we've entered the last name of Jones, and we have chosen or hit the box for find. And in this fictional facility, there is only one individual with the last name of Jones. It happens to be Katrina Jones. And if that is the individual for whom I want to provide rights, I will choose the option for edit. And then on the next screen, I will choose edit rights. And then on the next screen, I can indicate the rights for which I want her to have available to her. In this case, she has rights to add, edit, delete, and view data, but the options for those activities for staff are not checked. So I would need to check those boxes and hit save in order for her to be able to access staff data, as well as add, edit, and delete. Next question is, my local health department called me about a positive test result in a resident, but there was no positive test result. What is wrong? Every POC test result that is recorded in NHSN results in a test message being sent to AIMS. This means that if a test result is subsequently changed in NHSN, a new test result will be sent to AIMS. So if a positive is originally recorded in the platform, and then it is subsequently changed to negative, even if it's immediately changed, a minute later, 30 seconds later, as long as it was changed after it was saved, there will actually be 2 test results sent to the state health departments. First a positive and then a negative. In some cases, state health departments parse out their negative test results, meaning that they have them pulled out and they don't even look at them. So in those cases, they may only see the positive test result. They may call your facility and say, oh, I have Mr. Jones' positive test result. Currently in NHSN, there's no way for your facility to see that your test result was actually modified or changed by someone in your facility. All you have is the final test result for that person for that date, which is a negative. This is something that will probably be changing. But in every situation that we have heard about where a positive test result has been reported by the state health department as received, and the facility has stated that they haven't had a positive result for that individual, NHSN has been able to go into the database and identify the positive reported result followed by the change to a negative result. So this is important for you to understand. In many instances, the health department will end up talking to someone who was not the person that entered the result or changed or modified the result, so they're not even aware that it happened. And sometimes the person that made the change doesn't even recall doing it because they enter so many results. So just important for you to know. What do I do if the NHSN facility administrator for our facility has left and a replacement was not coordinated beforehand? On the screen is a link to one of our website pages. And on that website page is a facility administrator change request form, as well as instructions should you end up in this situation. This happens more than you might guess. And so our user support team at NHSN at cdc.gov is more than ready to help you with that. But going to this website and filling out the form is the first step in that, in making that, getting that resolution for you. So now we're going to go ahead with our demonstration. We're going to first look at manually entering test results, and my pathway for getting into NHSN may look a little bit different from yours, and that is okay. Once we get into the component, things should look exactly the same. Let me try this once more. This happens when I've been out of the system for a bit, so okay. Here we go. So once we get into the long-term care component, as I said, everything will look the same. I am going to be going into a fictional NHSN facility today, and all of the data that you see that we enter is going to be fictional. Again, we select a long-term care facility from the component options. You may only have long-term care facility as an option. And then from the select facility group, you'll choose the facility for which you want to enter the data. Again, the number of facilities that you have rights to enter data, for which you have rights to enter data, will determine the options that are available to you for that. And then we'll hit submit. So now we're in the LTCF component homepage. And from the homepage, we're going to choose COVID-19 on the left-hand navigation bar and choose POC test result reporting. This takes you directly to the page on which you can begin to enter the test results data. So let's first walk through entering a test results for a new staff person. Notice that when staff is selected, the address data field appears. So I have three choices: resident, staff volunteer, and visitor. Again, if you as a user have not been granted rights for staff, the only thing you'll see here is resident. So you'll notice that I now have address information. And this is because for residents, the system defaults to the facility information, but we have to have it for the staff information. We have to assign a staff ID, and it can be any number that you want. You should have a system for assigning staff IDs, but whatever it is, it has to be consistent for that individual. And it's going to tell me it could not find that staff. You can directly enter a new staff from the screen. That means this person's not in the system yet, and that's good. That's what I wanted to do. So we're going to put in a new person. Let's put in test, first name test and last name 40. And say that this person is female. Their date of birth is 11/11/1999. They are non-Hispanic, and we'll say they're white. And then I have to enter their date, their address. You can see it's giving me choices of previously entered data, but I'm not going to use any of those. I'll put in to Main Street. Anywhere, Idaho, just choose one. Gives me options for counties for Idaho. Making things up here, but just for example purposes. And then I'm going to hit save. So it tells me that the data has been saved successfully. Click if you are finished entering the demographic data. Click new if you want to enter demographic data for another staff volunteer contractor. So I don't want to do another demographic data right now. I want to go ahead and put some test results in. So I'm going to say, okay. So it leaves me on test 40. And now I can go down to the bottom section, which is the test results data. And you'll notice they have no test results yet. So I'm going to go ahead and enter test results. I get this screen. And let's look at the screen first and just talk about it. There's an area for test date. And then you notice that several of these other data fields are already filled in. And that's because a default has been chosen, and that for the device type, and that is a Dexis. Someone went ahead and set up a default device that's being used in the facility. And that Adexis device has only one type of test that can be ordered for that. So it's defaulted here, and that's an antibody test for SARS-CoV-2. There is more than one specimen source that can be used. You can use plasma, serum, finger stick, or venous blood for that test. So it doesn't default those, but it does list only the approved specimen sources. And then under test performed, it does only have one test that can be performed. It's the same test as ordered, and it has test result options of positive and negative. You'll notice that the system defaulted, automatically gave you a specimen number, unless you need to change that for some reason. You can simply leave that. It defaulted the physician name. Again, someone has gone in and pre-filled the physician name and identified them as your default, someone in your facility, and it's defaulting the answers to whether or not the person was symptomatic or pregnant as no. So let's look at the physicians list. These are all the physicians that have been added in the system. If we wanted to add a physician, we could choose this. We could go in and add another name. First and last name are required, and zip code, and hit save. And we would have a new one. If we wanted to identify a different default physician, we simply choose who we want and say save as default. And now you'll see that Bob White is the default physician and will be listed as the physician for all tests automatically. Likewise, you can choose a default device, and this is probably the most important one, because we have such a long list, as you can see, of devices. It really does make it much quicker to identify what your default device is. What device are you using? Let's say the facility is using the BD Veritor system. So that's what I want as my default device. But sometimes we run out of BD Veritor supplies. And so I want to set a secondary option for the default. And when we don't have BD Veritor, we instead use the, let's say we use the Q COVID-19 test. So we're going to choose those two. And what you'll see here is now when I go here, oh, I didn't uncheck AdVate, so it's still checked here, but BD Veritor is first, and then Q COVID-19 is checked, is listed as second, and AdVate was still in there. I could go in and go back and uncheck AdVate. Save as default, and then we'll see that it's just the two that I wanted. So I'm going to go in and add my test result. I put in the date, and it's either going to be yesterday or today because it has to be reported within 24 hours. This is the test device I used. I don't have to change that. I don't have to change the test order. And for Veritor, BD Veritor, there's only one specimen source that can be used. That's nasal swab, so I don't have to change that. All I have to do is put in the result. They were negative. I don't have to change the specimen number, the physician number, and they weren't symptomatic or pregnant. So it's really quick. I can just hit save. And there I have it. I have their test date, test performed, and and it was negative. So there's my entry. If I'm ready to enter another result, I just choose, I'm done, start a new POC test result report. It says that you're starting a new result report, and it's going to clear the current screen and allow data entry for a new individual. Are you sure? And I say, okay. And telling me I'm leaving this page. Okay, so here I am. Back to the screen again. Now, if the individual is already in the system, all I have to do is go in and say, find that person. I can choose to find them by their type. I can say, oh, it's a staff person, and then I'll just get all the staff people. Or the easiest way is probably to go by their last name. So their last name was 40. There she is, 40. I select her. I don't have to enter any of that information. I can go directly to add a test result and start her adding her new information the next time I have a test result for her. So let's now talk about uploading demographic information. We're not going to talk about uploading test results because that information is available in another video. But if you were to upload test results, that would be done here, uploading in that CSV. If you need to upload demographic data only, you do that here through the import export. And you can see that you have a choice for resident information or staff demographic information. We're going to do a demonstration for staff. So choose staff. I have to choose the file, which I should have ready to go. And I do. This is my file that I created today. And then I say submit. And I've actually got a couple of errors on purpose in this file. So you can see it had three lines of data. One went in all right. One inserted one line, but 2 lines of data were bad. And I can scroll over and see what the lines of data were bad. Oh, it was my county data. And I know that those are bad. As I said, I knew that I put in bad data. So what I can do is I can say I want to edit that data. It opens it up for me. Nice thing about county is that it will go here and I can choose the county. That's right. Save it. Do I want to record? It's moving it into the insert record collection. That's good. Okay. Edit this next one. What was the county? It's the same one. Save. Record it and move it to the record collection. Okay. So now it's ready to insert all 3. I hit submit. And the data was successfully imported. So now those individuals are in there as successfully imported. However, I do want to show you where you are going to need to get those templates from. So if you go to NHSN and you go to that COVID module that I was showing you, the long-term care COVID module page, and you scroll down, and I really suggest that you bookmark this page, and you scroll down to the data import, and you go down to point of care testing, CSV data, demographic data. You're going to find a CSV file template, which you can use as a template, and you just fill in the columns with your data. But how do you know what to put in there? Well, you will go to the file layout, which will tell you exactly what you need for each of the file, the cells. So for the ethnicity, you can only say HISP or no HISP, for Hispanic or not Hispanic. For race, you must say AMIN for American, Indian, or Alaskan Native, or Asian for Asian. These are the only choices you have. If you have somebody living or working in your facility who lives in in Mexico or Canada, you're going to need to look at this to know how to answer the informations about the province or the Mexican state. So this is also an important file for you. And finally, this file here is important because this is where you get your county codes, which you need for uploading. So each of your states has codes for your counties. Alaska, the various county names and the county codes that you're going to need to use. So I had the wrong county codes. I had a county code that didn't actually exist for Georgia. And that's why I got the error message. but this is the data, the file that you will use to get the county codes. Okay. So let's go back to the system and look at analysis fairly quickly. I want to talk to you quickly about generating data sets and what this means. You'll notice that this is telling me that data sets were last generated on December 3rd at 1:41 p.m. And today is December 9th. I'm going to go ahead and generate data sets right now. And while it's generating them, we'll talk about what that means. It's saying, are you sure you want to continue? The current sets will be updated. And I'm going to say yes. So everyone's data sets are unique to the individual. My data sets are unique to me. When I go in, what that message was telling me was that any data that had been entered by anyone in the facility after December 3rd at that time would not be included in my data, in my analysis, unless I generated my data sets today now. So anything entered after that date and time up till now would have not been included if I did not generate my data sets now. So in order to get a complete listing of all data entered up until now, I always want to go ahead and generate data sets. It shouldn't take very long, but the more data you get into your system, the longer it takes. You'll notice that it does tell you that you can log out or continue to work in other areas of NHSN. If you have data that you, other components that you're working on, you can go out and do it, work on it, and the progress bar will tell you where you're going. Or how you're doing. But this is almost over. And then we're going to go ahead and go into the reports and look at those 3 reports. Okay, it tells me that it generated those successfully. So I simply say, yeah, okay, you'll see now it's telling me December 9th at 4:06 p.m. It generated the data sets. So now I'm going to analysis and reports. And I'm going to COVID-19 module, POC test reported testing. And you'll see I have my 3 line lists there: resident, staff, and visitor COVID-19 testing. I also have custom reports. I can build custom reports and save them. And you see I have 4 reports that I have built and I have saved. And this is really handy if you have a routine report that you need to run frequently and you just need to change the time period. You can build it and save it, and then just go in and change the time period each day. So let's just look at the staff and I showed you again, this is the default. But what I want to do is I want to show you the option for modifying. So I have this option to modify. I can also export the data set. I can format it as an HTML, a PDF, an Excel file, or an RTF file. Rich text format. I can title the output. I can change the time period if I only want, for instance, a certain date. If I want just the result dates for March 2021, March 1st to the March 30th, I can put that information in here. I don't do a lot with filters. You can go in here and play around and see what you can do with that. You cannot hurt anything. I would highly encourage you to play around in this system. But the really helpful things that you can do is that you can change the display variables and you can sort the display variables. So the available variables are here on the left. The selected variables that are going to show up are on the right. And we're going to modify this. So let's say we want to add the variables of last name, first name, and specimen collection date. And we can do this by, if you're picking and choosing, you can hit the control button and choose, you can skip between selections. So first name, last name, and specimen collection date. And then you'll notice that there's a right arrow here. If I choose that, it moves those to the right-hand side and they're selected variables. Now I want to remove certain variables. I don't think we need to know org ID because it's going to be the same for all of them. And I know my org ID, it's my information. I don't need test ordered. I just need test performed. And I don't need to know the physician's last name. So let's do the same thing here. Choose control. Physician last name, facility, org, and test ordered. I don't need those. So I'm going to move those over here. So they're no longer going to show up. Now I want to move, this is the order they're going to show up in. This is going to be the first column, second column, third column. I don't like that. I want to move them. I want last name to be first. I'm going to move it up. And then I want first name. And then I want the test result. And then I want the specimen collection date. Oops, move it down. Okay. And now I want to sort how these are going to be, but the sort is the grouping. And I want all of my positive test results together. And then after that, I want them sorted by the specimen collection date. So I have to move test result over to the right. Oh, test result is already, no, it's not already here. Test result. Here, I can move that over. And specimen collection date, I also need to move over. So you can do them one at a time. And the first thing I want it to be or grouped on is the result, and then the specimen collection date. So the most important thing is to get those at the top because that's the order. First, it's going to be sorted on test result and second on specimen collection date. So now let's just run it and see what it looks like. So you see that all of the negatives are together. It is last name, first name, test result, specimen collection date. All of the negatives are together, all the positives, and then they're in the order within the negatives. They're in the order in which they were collected, and the positives are in the order in which it was collected. So for me, that's going to be much more helpful information. So you can see this is be really helpful. Now, if this is something that I'm going to use, I could save this as a custom report, and I can change the date of the data every, however often I use it, or I can just run it continuously with all of the continuous data. That's a quick and dirty of the analysis options that are available right now. So we're going to go back to our slides really quickly and summarize that the NHSN point of care test reporting tool for COVID-19 is the CDC and CMS's preferred method for CMS certified long-term care facilities to report their POC test results, and it enables the facilities to report the data, which then gets shared with required entities, which are the state health departments and the US Department of Health and Human Services, as well as the CDC. It has been developed to be minimally burdensome, and enhancements to the tool have been made in response to user feedback. And we do have a lot of resources available for use of the tool, and they can be located on the link that's available here. If you have any questions at all about the tool or about this training, please email us at nhsn@cdc.gov and include in the subject line the POC test reporting tool. Thank you for your attendance today and your attention.